This is an emergency ultrasound of a 28 years patient who was operated upon for inguinal hernia left side and is toxic, is having fever with rigors, and he has a enlarged, tender, red left side of the scrotum, and he has been sent for ultrasound without any laboratory investigations, or he was operated upon 10 days earlier. Now he is having vomiting as well as diarrhea with high grade fever with rigors, and this is happening for the last 2 days. Though he has not eaten anything, nothing goes inside him for the last 10 days, operated upon 10 days back just for left inguinal hernia at some local hospital. So we start the scan from this region and see what has gone wrong. Now to see, this is the liver, this is the left lobe of the liver. In emergency you don't have much time, so you do as early as possible. If possible, you can wait. This is the left lobe of the liver. Okay. This is the aorta. This is the pancreas. This is the pancreas. So pancreas is normal. Now this is the diaphragm, right hemidiaphragm, and there is no fluid in the pleural space. There is no subdiaphragmatic abscess formation. This is the gallbladder. This is the gallbladder. The liver is normal in texture. Kidney is normal. Porta hepatis shows normal patent portal vein. This is the portal vein. This is the ligamentum venosum, the caudate lobe, the IVC. This is the IVC. Liver is seen below costal margin, though parenchyma is normal. No focal lesion is seen within the liver. No para-aortic gland lymphadenopathy is seen. This is the central, this is the proximal aorta, this area. This is the proximal aorta. कोई बात नहीं बेटा, फिर आप करने तो दो. Now this is the spleen with diaphragm. This is the left hemidiaphragm. No fluid, no pleural effusion, no subdiaphragmatic abscess. Spleen is normal in dimension. This is the left kidney. Kidney is okay. This is the kidney. Now, when I come down in the pubic region, this is the urinary bladder. This is the urinary bladder in transverse section, and this is the urinary bladder in longitudinal section. This is the urinary bladder in longitudinal section. No pathology relating to the urinary bladder. However, you see a fluid posterior to the urinary bladder from the pelvic region. It is going upwards towards the right lower abdominal quadrant with septa and internal echoes. Now it is extending upwards up to the right lower abdominal quadrant. See the characteristic of the fluid collection, that this is the fluid pocket measuring 64 millimeter by 35 millimeter, and see the septas. These are all septas, and there is debris as well. Now it makes a track posterior to the urinary bladder. Here you see I'm following it. This is the same fluid with echoes now. It's making a track posterior to the urine. This is the urinary bladder, posterior to the urinary bladder, and here it enters the subcutaneous tissue. It's only 30 mm deep to the skin. Here you see it's making a track posterior to the urinary bladder. This is the urinary bladder, making a track, going upwards and up to the left paracollicutor. Now this is the left paracollicutor. This is the left paracollicutor with, this is the source muscle. This is the left paracollicutor, and see the fluid with internal echoes and septas. So this is this is a collection, an abscess or bleed posterior to the urinary bladder with bowels floating in the region of the, so you see it makes a track. Now this is the region of left iliacus. This is the left collicutor. This is the source muscle. Okay. Now follow this. Here it expands posterior to the urinary bladder, and now here it's entering the right lower abdominal quadrant where the maximum expansion is seen. This is the right lower abdominal quadrant, and these are the iliac vessels, right iliac vessels, and we do not see any lymph node in this region. So this is the story. Now, when I come to the scrotum, which is swollen, that you saw, and try to get the coronal view first to see the testes, and these are all bowels within the fluid in the left scrotal region. These are bowels in the left scrotal region, in the left scrotum, left hemiscrotum. And this is the left testis. And posterior, this is the coronal view, in which okay, now this is the left testis in coronal view, and this is the right testis in coronal view. Now they are pushed downwards with the scrotal wall. This is the scrotal wall. Just for 1 minute. And there is now the right testis in longitudinal section is normal. This is the longitudinal section of the right testis, normal. the mucogenicity, no focal lesion, though the scrotal wall, this is thick and edematous. Okay, now see, now I am going to scan this area. This region of the scrotum which is swollen, this right is okay, right testis was normal. Now let's see in this area. Okay, now. So this is the story that there is a lot of fluid in this scrotal region, and there are bubbles entering into the left hemiscrotum. These are all bubbles. This is a bubble segment, this is a bubble segment. So bubbles are entering, this is a bubble segment, long bubble segment, entering this is a bubble segment in transversection. They are entering the the left hemiscrotum. So there is a scrotal hernia with bubbles entering the left hemiscrotum. Thereby, now you see that this testis is being pushed to the wall of the left testis is pushed to the wall of the scrotum, left scrotal wall. So this is straight away a case of collection in the lower abdomen, extending into the subcutaneous tissue as well as the right lower abdominal quadrant with because the patient was operated for left inguinal hernia, the bubbles have entered into the left scrotum that is in front of you. This is the total of the okay. Now you see this is the left scrotum in total with bowels. So scrotal hernia, the bowels are in the anterior part. This is the testis in transversection. This is the right testis, this is the left testis. So the conclusion is that this patient is toxic because of all the findings that I have. The collection, number one, in the lower abdomen, extending into the left hemiscrotum along with bowels. And the fluid contains septa along with debris. This is the fluid in the right lower abdominal quadrant, making a tract posterior to the urinary bladder and going up into the up to the left paracaudal gutter, where it is seen only 30 millimeters deep from the skin, and it's all filled with, this fluid is filled with aqueous. So this is the case of multiple pathologies post-operative. Thank you.